Fibromyalgia in 3 minutes. Another very common condition that is another yuppie disease, another basket case diagnosis where when the doctor does not know what to diagnose you with, after they have ruled out everything that is extremely severely pathological, they finally say, we don't know what you have, so we're going to give you a name, fibromyalgia, which simply means pain in the muscle and in the fibers between the muscles. That's all it means. And it doesn't tell you anything about the cause. You should always ask why. Why do I have fibromyalgia? Don't say, oh, I have it. Great, now what drug do you give me for that? You want to be put on drugs for the rest of your life? That's what's going to happen. Ask why, because there are answers. I can give numerous examples of processes in the body, biochemical processes that could lead to fibromyalgia symptoms, and then they will be diagnosed like that. For instance, if you have excessive oxalic acid buildup in your tissue, which is something that occurs because of the diet and because of lack of calcium in our foods today, because of the soil being depleted or because of fat malabsorption, we can develop fibromyalgia because the oxalic acid that we are ingesting in healthy food will accumulate in the tissues and ultimately crystallize and cause pain. That's just one potential possibility. Gluten, because it causes an immune reaction, which among other things attacks the immune system, attacks the fibrous areas surrounding each muscle fascicle or each muscle fiber. A lot of people who have chronic muscle pain could be simply inflamed from an autoimmune reaction to gluten. Also, fibromyalgia is associated with magnesium deficiency, and it's associated with deficiency or problem with the Krebs cycle in the mitochondria, not making enough ATP molecules in the presence of oxygen, which therefore lead to anaerobic metabolism, an insufficient production of ATP molecules, which are energy-rich molecules the body needs for all of its functions, including muscle contraction. So if you don't have enough ATP, or if your mitochondria are poisoned, you will end up not allowing your muscles to recover after a few contractions. So you will end up developing pain. And all of that can be treated, it can be reversed, it can be successful, guaranteed, if you spend just a few months doing all the right things, which is eliminate the toxins, put in the nutrients, eliminate the excessive physiological dysfunction like oxalic acid or gluten inflammation, and ultimately the problem simply goes away.